Hi guys, welcome back to my YouTube channel. If you are here for the first time, my name is Nosife, and in today's video I'm going to be talking about gonorrhea. What is gonorrhea, the causes of gonorrhea, and how gonorrhea can be treated. If you are new to my YouTube channel, kindly click on the subscribe button to join my YouTube channel and on the bell icon to get a notification whenever I drop another amazing video. Yeah, welcome back. As I said earlier, in today's video I'm going to be talking about gonorrhea. What is gonorrhea, causes of gonorrhea, and how gonorrhea can be treated, so we can all have a better understanding of what this particular infection or disease is all about. First of all, what is gonorrhea? Gonorrhea is a sexually transmitted infection in which, when untreated, it can lead to infertility and can be more dangerous to that particular person. And this gonorrhea is caused by a bacteria known as Neisseria gonorrhea. And Neisseria gonorrhea can be found in the fluid of the vagina or around the vagina. And the bacteria can also be found in the fluid inside the penis or around the penis. I know what will be on your mind now is, how can this gonorrhea be transferred from one person to another? Gonorrhea is transferred through sex. That is why we call it sexually transmitted infection. And in the case of mode of transmission, it is transferred through sex, which could be oral sex, and it can also be vagina to penis sex, it could also be anal sex, and also the mode of transmission can also be individual sharing sex toys which are not properly washed or cleaned. That now take us to the signs and symptoms of gonorrhea. The number one signs and symptoms I have to share with you is a thick green or yellowish discharge, either from the vagina or from the penis. When an individual is having this particular color of discharge coming out from his penis or from a vagina, this may be a symptom that person is having a gonorrhea, and it should be taken note of. The number two signs and symptoms I will be sharing with you is pain during urination or burning sensation during urination. A person that is having gonorrhea usually have a burning sensation during urination or pain during urination. The number three signs and symptoms is frequency in menstruation or urination. When an individual is having this urge to always go to the toilet to urinate, that particular person may be having a gonorrhea infection. The last signs and symptoms I have to share with you is bleeding in between menstruation. As a lady, if after seeing your normal menstruation and for one reason or the other you are seeing your period again a week after or a weeks after, this may also be a sense that you are having a gonorrhea infection. And for men having gonorrhea, they usually have solo scrotum or testis as a sign, and this sign should be taken note of. That now takes us to the 10 facts I will be sharing with you in this video in regards to gonorrhea. Number one fact is that gonorrhea affects both gender. Gonorrhea do not just affect only the female gender or the male gender. Gonorrhea both affects the both gender. The number two fact is that gonorrhea is transferred only through unprotected sex. You cannot just contact gonorrhea by sharing towel or toilet. Gonorrhea can only be transferred when you have unprotected sex. The number three fact is that the bacteria called Neisseria bacteria only grows in the throat and the reproductive tract, and if it is not treated, it can affect the eyes, the rectum, and the urethra. The other fact is gonorrhea is very much preventable. How can we prevent gonorrhea? By using condom and by avoiding unprotected sex. The fifth fact I have to share with you is gonorrhea can be treated. Yes, gonorrhea can be treated with antibiotics. Other fact is it can lead to infertility. When gonorrhea is not being treated, it can lead to infertility later on in life. Other fact in regards to gonorrhea is gonorrhea symptoms are not seen immediately. It takes about 15 days to 20 days before you start seeing signs and symptoms of gonorrhea. The other fact is always avoid sex while treating gonorrhea to avoid reoccurring of the infection. You should also know that gonorrhea can be transferred from mother to child. Yes, gonorrhea can be transferred from mother to child. And when you are treating gonorrhea, when you are treating this particular infection called gonorrhea, also allow your partner to get tested and to be treated when found infected also. So you both can be treated perfectly and to make sure the infection is no longer in your bloodstream or body system. Last fact is that after completing your treatment, also make sure you go back to the hospital to test to make sure that the bacteria is no longer in your bloodstream or body system and that it has been fully treated. Lastly, I will be talking about how we can treat gonorrhea. First of all, after having these signs and symptoms of gonorrhea, what you just have to do is to go to the hospital. Avoid going to the pharmacy to get antibiotics by yourself. Go to the hospital to see your doctor so you can be diagnosed properly and you can be treated properly in the right way also. Make sure you follow up with your treatment and your doctor may give you antibiotics, oral antibiotics, put you on IV infusion also, and you may be given injection. And make sure you follow up with your treatment and make sure you complete the doses of your drugs and avoid sex when you are being treated. So this infection will not occur again and you will not transfer it to another person. Get treated completely. The infection can lead to PID, pelvic inflammation disease, or infertility later in life. Thanks for staying to the end of this video. Don't forget to like, don't forget to subscribe, and if it gives values, share to a friend. To all my returning subscribers, this Nosy fellow, I say thank you.